This is much more serious than anyone really thinks it is.
It seems like it happened overnight, from outbreak to epidemic to pandemic, and suddenly nothing in our lives is the same. We're all learning how to negotiate that new normal and striving to keep our lives as normal as possible.
Mental health is as important as physical health.
But when these sort of situations involve constant hand washing, social isolation, shortages, and unemployment for many, how are we to cope? And what could possibly be coming next?
What happens under chronic stress is that we're worrying about later, and we're trying to solve for later, the what ifs that are coming down the line.
We're all looking for those answers. Fox 11 News In Depth starts right now. Hello, everyone. I'm Hal Eisner. Welcome to Fox 11 News In Depth. I'm at home. This is how we're broadcasting during these days of the coronavirus. And our guest, Michelle Constant, is somebody who deals with things like this. She's an expert in the area of pandemics. Hello, Michelle. Welcome to the show.
Hello.
You know, I guess the very first thing I want to ask you is about this pandemic and sort of give us your sense of how we got where we are, and are we doing a good job of trying to deal with this?
Well, it's been interesting for me and my company in particular because pandemic planning is something that we do on a day-to-day basis. So for us, we feel like we're living one of our case studies. But what we're seeing is the government is putting into action many of the things that we planned for. So for example, we've worked with the government to do things like non-pharmaceutical interventions or NPIs. And we're living NPIs, how you are living an NPI right now. NPIs are things like personal actions, hand washing, covering your cough, community actions, social, or the governor calls it physical distancing, school closures, and environmental actions. That's things like cleaning off surfaces. And with pandemic planning, we've also talked about public-private sector partnership. I heard the governor just talk about that in spades here in California, with coming together with commercial partners to do things that can mitigate the spread of disease. So he mentioned Kaiser Permanente, for example, making available 2,000 tests. He mentioned Virgin coming online and providing a 747 to move supplies. So it's interesting to see some of the pandemic planning practices come to life.
You know, Michelle, I want to, for transparency and to be clear, we're taping this on a Wednesday. And this is such a fast-moving medical brush fire that by the time we get to Sunday when this airs, everything you just said could change. And so I just want to be very clear that if you hear some things that aren't the same on Sunday as they were on Wednesday, this is why. We're taping this in advance. So I think we ought to stick pretty much with broad brushes here and tell us a little bit about your company, what it is you do. You largely work, if I understand this correctly, with corporations. Is that what you do?
My company is Constant & Associates, and we're an award-winning disaster and crisis management firm. Our primary clients are government clients, and we work with all levels of government. We do health security and pandemic planning, among other things. And during non-disaster times, we call those blue skies. During blue skies, we do planning, training, and exercise. And right now, much like others in the industry, we've pivoted to COVID-19 support.
I want to ask you several things, Michelle, but one of which is how we are dealing with this. Every company, each state, we're all taking a little different approach. And for us at Fox 11, for instance, many of my colleagues are working from home. We're seeing things that I've never even dreamed that we would see before, and that's the producing of a show from somebody's home, from a producer's home, the hosting of a show, in this case, from my home. We have so many people in our station that are working from home and working in ways that, even though we're considered to be essential personnel as media, we are still trying to be as safe as we possibly can. Do you feel the companies and government have dealt with this feat well, or are there many lessons that we're going to learn out of this that hopefully will help us the next time?
There are going to be lessons learned no matter what. In fact, the government has a best practice. They do something called after action reporting. So after every disaster incident, they have a process where they look at what happened, what went well, what didn't go so well, and they take those lessons and use them to inform future planning efforts. In terms of how we're doing now, for me, it's very interesting to see many of the plans that we've supported the government in developing come to life. So implementation of things like the non-pharmaceutical interventions, the use of business continuity practices. You mentioned that Fox, a lot of you are teleworking. That's absolutely tremendous. And I think that shows the resolve of the American people.
But there are some things that unfortunately are not so tremendous, and that's the idea that we got to cut a little bit off guard here, maybe a lot off guard. And so there's been a lot of talk about these medical masks and the equipment the doctors and first responders, nurses, they need to have to work and to be safe. And well, first let's listen to Governor Cuomo and what he said about this, and then let's discuss.
We are literally scouring the globe looking for medical supplies. We've identified 2 million N95 masks, which are the high protection masks.
And so we hear these sort of things, and then now a few days later we hear about all these masks that are coming in, like in California from Virgin Airways and things like that. So we're trying to catch up. But what's your sense about how we kind of got caught with our collective plans down?
Well, I can tell you some of the resources that are in place to manage something like this. One key resource is something called the Strategic National Stockpile, or the SNS. And this is a network of supplies that's stored around the U.S. that has things like pharmaceuticals, medical supplies, and so forth. It can be quickly deployed to respond to something like this. It's managed by the federal government. Now, the SNS is not intended to replace the supply chain. It's intended to supplement local resources. And we saw it deployed for 9/11, for Katrina, for H1N1. We're seeing it deployed now. So there is certainly a reliance on the existing measures to receive supplies like this, but there's also substantial support that's available from the federal government. And again, I think the government is really leaning on this idea of public-private sector partnership to move forward with some of the most necessary measures.
You know, one of the things we've heard a lot about here in Los Angeles is this ship, this medical ship called the Mercy. And it has personnel, it has beds, it has all this stuff. And what is your sense of the Mercy? What is your sense of how this thing is going to make a difference, if it will make a difference? And we assume it will.
Yeah, it will make a difference. The idea with Mercy being sent to Los Angeles is it's meant to help alleviate the burden on the healthcare system. So we've heard a lot about this notion of flattening the curve. And the idea there is that we want to help the healthcare community as much as possible with mitigating some of the surge that's expected. And what the governor has done is he's requested Mercy to tend to the patients that are not COVID-19 positive or suspect. Mercy would see the patients that are coming into hospitals with other ailments, so that patients that are received at other local area hospitals can be received by healthcare personnel.
We're going to keep Michelle on for another segment. Michelle Constant joining us this morning. And you know, another thing is that we're dealing with this issue of people's jobs, people's livelihoods. We need to talk about that after the break.
I have a car payment, I have other payments, my phone bill, and if I can't pay those, then I'm going to lose them.
Michelle Constant with us right now, who deals with these pandemic sort of issues and helps people and governments and has a lot of advice on how to deal with pandemics. You know, what you just heard, Michelle, and what everybody heard was something we're hearing a lot of. We're hearing a lot of people who have lost their jobs. Businesses have had to close. It's affecting so many livelihoods and our economy in general. Talk about that for just a second.
Absolutely. Well, we're seeing, fortunately, a lot of movement in the government to help alleviate some of the pains that the general public are experiencing due to downturn in the economy because of everything going on with COVID-19. So there's a couple of things that everyone should know about. First, there's something called the Families First Coronavirus Response Act. And this was passed. It includes additional provisions for extended sick leave if we need to take it due to COVID-19. It also offers things like flexibilities for parents who have kids and they're affected by school closures. There's also something called the Coronavirus Aid, Relief, and Economic Security Act, or CARES Act. And this offers a lot of additional provisions for businesses. This includes things like tax credit rebates of up to $1,200 per individual, It includes the delay of employer payroll taxes. It also includes the deferral of excess business loans. So there's a lot that's being activated right now to help ease the pain that some folks are experiencing.
You know, there are a lot of things that are being implemented, executive orders that are being signed by the president, by governors like Governor Newsom, and things to help relieve this economic tension. But I had somebody write me on social media, and I want to pose this question to you. The question is, we hear about, say, the mortgage delay. There are several banks here in LA that are following along. What do you have to do to qualify for that? For instance, if you have a job, if you're working from home, you're getting a paycheck, would you qualify for one of these things that offer relief? Or do you have to show that you're out of work, that you're not getting money, so you can't pay your bills?
The good news is the government has multiple programs that can help folks with relief. And they are moving forward expeditiously to offer loans, to offer forgiveness. They're trying to minimize the paperwork. They're trying to expedite the process. So they're loosening the provision significantly, and folks have multiple options they can go with.
I understand that, but if you're working and you're getting your regular paycheck, one would think that you, unless you have some kind of an impact from another family member or something like that, you wouldn't really be in a sort that you would need to have some kind of help.
Right. You will need to show that there's some sort of hardship presented by COVID-19.
And that was the question, really. So you have to show hardship. Now, let's talk about the companies themselves. You get a company, a restaurant, let's say, they close their business because nobody's coming in because they can't do business unless it's takeout. And so all their employees are out of work, and nobody knows when they're going to get back to work. What's the impact on the business? We can certainly figure out the impact on the employees.
There's a tremendous impact on the business, on the employees, on the economy at large. One of the great programs that's available right now is an economic disaster recovery loan. It's available through the U.S. Small Business Administration, and there has been additional funds allocated toward that. But that's a loan that businesses can access very, very quickly. That's another program that the government is looking to expedite. So even for the small businesses that are out there, that's certainly a loan that you should look into and see if you can use it to either reopen your virtual doors or keep your business operational.
I want to ask you about when people get back to work. I have another question for you right afterwards, but I want to ask you about when people get back to work, what do you think we'll see? How do you think this is going to go? I mean, some people, some stores, some businesses may have a very hard time reopening their doors.
They might have a hard time. What I anticipate that we'll see is a staggered reopening of businesses. I anticipate that that's going to be a reaction to the health orders. Hopefully we'll see a decline in the number of new cases based on some of these protective measures that are being implemented, and that'll result in a relaxation of some of the health orders. But I do think that there will be a staggered amount of businesses coming online.
I think I heard you say that you consult governments. I wondered, have you consulted Governor Newsom? Have you consulted Mayor Garcetti? And whether you have or you haven't, what do you think of what they're doing? Each one of them out there, front and center, news conferences every day, trying to be somebody that people can coalesce around.
I'm very fortunate, and then my company has supported both the state of California as well as the city of Los Angeles, and I think they're doing a tremendous job. One of the things that we really need right now, either locally or as a nation, is leadership. And we need officials leaning forward into this pandemic. And I think that's what we're seeing in California.
Michelle Constant, I want to thank you so much. I know you got a lot of work ahead of you, and we all do, really. But thank you so much for being here, sharing some of your thoughts, giving us some ideas on things that people can do. And here's something else, stress and coping. How do we deal with that? After the break. Be right back. A week of crisis, many weeks of crisis going on here. And, you know, how do we deal with this? How do we cope? What's going on with our jobs, our lives? I want you to listen to this young lady, and then on the other side, we're going to talk about it.
I'm a full-time student and I was working 3 jobs, but due to this coronavirus, I have lost all of my jobs. I live with a single parent. She also is unemployed. I'm really not getting any help at the moment.
And this is somebody who, by the way, drives from Acton all the way over to Westlake Village in order to work one of her jobs. This is somebody trying very hard to make money and now suddenly has lost all 3 of her jobs. John Silamparis is a therapist. He's with us now here on Fox 11 News in Depth. First of all, tell me, what is your reaction to listening to that young lady? She's 22 years old.
It's pretty typical. And, you know, what's scary for everyone is the two variables of uncertainty, which is we don't know a lot about the illness. We know a lot about the common cold and the influenza, but we don't know a lot about coronavirus. And the other variable is we don't know how long this is going to last. If it was for 1 month or a few weeks, people would say, I'll adjust, but this could go on for a long time. So I'm getting a lot of what I'm hearing from her, what I'm hearing from everybody else. So it's very typical.
I've got to tell you something. I've been in this business for a very long time. I've covered all kinds of stories. I've been in all kinds of situations. I've been through the swine flu. I've been through all these different things that we've had to deal with. I have never seen anything like this. I've never, ever been in my home broadcasting like this. We are in a very new place. And what is your sense of us being at home, many of us alone, coping with that, and especially those who may have some mental issues going on, mental disorders, mental illness? I know this is an area of your specialty.
Yeah, look, it's unprecedented, as you just said. You know, remember, anybody can suffer the long-term effects of isolation, but for people with mental health conditions and the elderly, it's particularly difficult because remember, we are social creatures. You know, we didn't evolve in a vacuum. We need each other. And so social isolation or social distancing, it challenges the very fundamental basic instinct to reach out and to seek support from others and from groups of people. And so this could cause people, increased depression, more emotional withdrawal. It'll make them, over-focus, over-magnify on these problems. So I'm concerned for them and for the elderly.
Well, what are some of the things that we can do to sort of combat this?
Well, the main thing to do is to try to learn self-regulation skills or to practice self-regulation skills. You know, doing that helps you to prevent going into emotional reasoning. Emotional reasoning is when you start to confuse feelings with facts. And once you do that, you start to have poor impulse control and you make bad decisions. You snap at people, you go hoarding at stores, you just basically make bad decisions. And so I tell people to try to do a 5-minute rule, pull back, take a couple of minutes, and really sort of like think about the situation in a more sort of rational way. And within 5 or 10 minutes, your thoughts are going to be a lot different than from when they were before. So people have to pull back. I also tell people to try to practice news hygiene. You know, it's good to stay informed and it's good to stay up to date, but you don't want to saturate. So stay updated, but don't saturate, because it's going to cause you much more distress and much more hopelessness.
While you were saying that, one of the things I was thinking about is perhaps somebody who's elderly, who's alone, sleeping in bed. It's dark. They've been doing this for 9 or 10 days or whatever, and they start to confuse that sense of loneliness with the facts of the situation, and that's when you're saying we ought to take 5 minutes and step back.
Yes, and so because we live in an era where we have technology where we can stay in touch with each other and we can see each other and hear each other, to really promote this kind of connection, to use your email, to use your text, to use your phone, and to use these sort of video chat platforms. But yes, for anybody that's at home by themselves, to really try to monitor your emotional reasoning. Also, try to keep a sense of normalcy at home and try to keep busy. Whatever things you used to do at home, continue to do them. And if you are stuck at home, try to do other things. Try to get back into old hobbies, maybe do some cleaning, maybe work on some projects at home, spend time with your kids. The more busy you keep, the easier it's going to be to get through all of this, however long it's going to take.
Yeah, there are other things you can do too. I mean, for instance, the gyms are closed. So what did we do? We went and we bought an elliptical. It's like, so we got a gym in the house now. So, I mean, there are things you can do, and there are things you can strive for. It just feels to me like you know, there's a lot of therapy that's probably needed right now. And, you know, we're probably all, you know, suffering from a little bit of feeling on an island when we're stuck at home, even if we have other people around us. Have you ever seen anything that even comes close to the kinds of isolation that people are having to deal with? I know I have on a wide scale.
Never anything like this. The last time I saw so much fear and so much angst in the streets was after 9/11 and maybe after the 94 quake in Los Angeles, if you were here. But remember, everyone thought after 9/11, no one's ever going to be able to fly. How do we fight this war? We don't know who these terrorists are from, what country they're from, and all that stuff. And then we got past it, and we're going to get past this. It's just not going to be as quick. You know, another thing to do is to really try to focus on what you have control over right now. It's very easy to jump to tomorrow and next week, so it's good to have contingency plans for sustainability. You know, make sure you have food and supplies and all that stuff. But really to stay, just as they say in 12 steps.
Right.
Here, it's
in other words,
one day at a time.
Take control of the moment, right? Take control
in
of the moment.
Yes. Like right now, you know, my job is to get through the day, and then tomorrow I'm going to worry about tomorrow. But to look ahead to next week and the following month really stresses people out. So the only way to get through it is to focus on the day. It's as corny as it sounds, it's the best way to do it.
All right, John Sillenpars, thank you so much for joining us. Thanks for some of those tips, some of that advice. I want to leave us today on an upbeat note, on something that makes us feel good. So when we come back, we'll do that. If you're looking for something to do, check out my podcast, What the Hell? You can get it wherever you get podcasts. I want you now to take a look at this picture. This is a picture of chalk writing on a sidewalk, some neighborhood kids in Los Angeles writing these words, everything will be okay. And you know what? That's really kind of the point, isn't it? It's a very important point. And so what we want to do now is leave you with this, a little music from the Chino High School chorus. It's uplifting. Have a good one.